Hi, my name is Kirsten Seegers.
And I'm Adam Gotlin.
And for our ME 485 project at Stanford University, we looked into combining kinematic and coordination gait modifications to reduce medial knee contact force during walking.
Medial compartment osteoarthritis affects millions of individuals around the world and is a leading cause of years lost due to disability. This disease can progress due to high contact forces in the medial compartment of the knee during walking. This is the focus of our study. Our research builds off of the contributions of pioneers in the field of walking biomechanics. In 2012, Peter Scholl showed that toe and gait could lower the first peak in knee adduction moment during walking. A knee adduction moment causes the tibia to rotate in the frontal plane into the femur on the medial side. Reducing this will shift the joint contact load laterally, thus alleviating the medial compartment. In 2014, Matt Demers showed that a more optimal muscle recruitment strategy can lead to a reduction in the second peak of tibiofemoral force. Tibiofemoral force is the total joint reaction force at the knee. Using a weighted activation squared function, we can penalize certain muscles that cross the knee, thus optimizing muscle recruitment and reducing total joint reaction force. Zach Lerner developed a contact model of the knee, which includes two frontal plane hinge joints to capture contact in the medial and lateral compartments. In our research, Lerner's knee model will be combined with Rajagopal's full lower body musculoskeletal model to more directly measure contact forces at the knee. In the present day, Scott Ulrich has made important connections from prior research. We already observed toe and gait alters the line of action of external ground reaction force, leading to a decrease in the adduction moment. In addition, internal muscle recruitment has a strong impact on total knee contact force. Each of these studies have covered only part of the story. Winby showed that true medial contact force in the knee is roughly 42% external factors, the ground reaction forces, and 58% internal factors, muscles crossing the knee. This leads us to our current study.
The research question for this study was, does toe and gait reduce the first peak of medial contact force in the knee? To answer this question, we analyzed 3 baseline steps and 3 steps of toe and gait from one subject. We combined Rajagopal's full lower body model and Lerner's knee model for analysis in OpenSim. We then scaled this generic model to our subject based on X-rays and motion capture data. To solve for gait kinematics, we utilized the inverse kinematics tool. To incorporate ground reaction forces, we then ran the inverse dynamics tool. Next, we used the static optimization to compute muscle forces. Lastly, we used the Analyze tool in OpenSim and our computed muscle forces from static optimization to calculate the joint reaction forces. To confirm the validity of our simulation results, we compared the knee adduction moment calculated from OpenSim to the knee adduction moment from experimental data for this subject. This experimental knee adduction moment was calculated using ground reaction forces and the position of the knee joint center. In this slide and all future result slides, blue lines represent baseline steps and red lines represent toe-in steps. As you can see here, both knee adduction moment plots show a similar reduction in the first peak that occurs during the stance phase of gait. This is also consistent with the result that Peter Scholl found that we introduced at the start of the presentation. Having confirmed the validity of our simulation, we began to dig into the muscle forces. We looked at 2 muscle groups, the quadriceps and the gastrocnemius, which actuate the knee during stance. In the upper left plot, we see that the quadriceps force for toe-in trials is reduced during early stance. Similarly, in the upper right plot, the gastrocnemius force during late stance is also reduced. These muscle forces directly contribute to a reduced knee flexion moment in early and late stance, shown in the plot at the bottom of your screen. Given the muscle force contribution on knee flexion moment, we examined the total knee contact force during stance. This is comparable to the tibial femoral force that Demers examined that we discussed earlier in the presentation. Similar to Demers, we see a decrease in total knee contact force in the second peak during stance. Leveraging the learner knee model, we then focus specifically on the medial compartment contact forces. In this plot, we show that in fact toe-in gait does reduce the first peak of medial contact force during gait when muscle forces are incorporated. The translucent lines in this plot show the range of trials examined in this analysis, with the bold lines representing their averages. In conclusion, we saw a reduction in the first peak of knee adduction moment, which validates our simulation results against Scholl's findings and our subject-specific experimental data. Further, when we examined the effective muscles, we saw decreases in the quadriceps force during early stance and gastrocnemius forces during late stance. Lastly, we show that the combination of external and muscle forces during toe-in gait in fact reduces the first peak of medial contact force in the knee. This demonstrates feasibility of toe-in gait as a prevention strategy for the progression of medial compartment osteoarthritis.
A major limitation of our work is that joint reaction analysis is very sensitive to muscle force, and muscle forces were estimated using static optimization. For this, an EMG-driven study can improve the accuracy of internal muscle forces. Before we can extrapolate our results to a clinical setting, we suggest a longitudinal study to determine whether kinematic and muscle recruitment adaptations persist over time. We also suggest future work to see if pairing toe-in gait with optimized muscle recruitment will further reduce medial contact forces. We'd like to thank Scott Ulrich, our project mentor, and all others who contributed to our project.